Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Ramona Brennan.
Hi, everyone. Welcome back to the Nourish MD Podcast. We are here with Dr. Shumway today. I'm Ramona, I'm one of your hosts, joined by Lauren, your other host, and Dr. Shumway, who is an ophthalmologist at the Beach Eye Medical Group. He's a board-certified and fellowship-trained ophthalmologist and a recognized expert in advanced cataract and refractive surgery. Dr. Shumway completed his undergraduate studies at Brigham Young University and earned his medical degree at the University of California in Irvine. Dr. Shumway's advanced training also includes a prestigious fellowship in Tampa, Florida, where he specialized in cutting-edge cataract and refractive surgical techniques, and his expertise encompasses laser-assisted cataract surgery, the use of advanced intraocular lenses, or IOLs, and industry-leading platforms such as the light-adjustable lens for vision correction. So we've got lots of great stuff to talk about today in relation to eye health. But Dr. Shumway, is there anything else that you would like to share with us, share with our audience about yourself or your professional background?
I'm really excited to be here. Thanks for that warm introduction. And the only other thing I'd say is that I'm just thrilled that I get to do this job. Every day I get to help people see better and feel better about their eyes. And I love what I get to do. So thank you.
Thanks, Dr. Shumway, for that. Really excited to have you here. Could you start off by just telling us the difference between an ophthalmologist and an optometrist and why someone might go to you versus an optometrist?
Great question. So an optometrist and an ophthalmologist do a lot of similar things, but they're different in the way that they're trained and the scope of what they're able to do. So an ophthalmologist will go to typically 4 years of college, 4 years of medical school, and then 4 years of residency training specific to the eye and surgery in and around the eye. So they've done a whole 12 years after their high school is completed of all this specialized training so that they can actually operate on an eyeball or operate somewhere around the eye, right? They're also able to do the things like prescribe glasses and contact lenses and those types of things. An optometrist, on the other hand, does 4 years of college, typically 4 years of optometry school, and then optionally could do a residency for a year, but not required. So we're talking about now just 8 years of experience before they become a licensed optometrist. And then they typically will only perform minor things in the office and prescribe glasses and contact lenses. So those are the main differences in the training. So you can see that there's a difference when you go to an optometrist, for example, a lens crafters or a Costco or an independent optometrist, usually to get glasses and contacts. And then an ophthalmologist, because we're so specialized, we'll typically focus on things like surgery. So, for example, if you need a cataract surgery, which is something that I specialize in, I rely heavily and I work heavily with optometrists to help me know which patients might need the procedures, and then they can send their patients to me when glasses and contact lenses are no longer helping with their vision. So I work, and I love my optometry colleagues because I've worked very closely with them over many years, and I've enjoyed a great working relationship with our optometrists.
Wonderful. That's super helpful to understand. Thank you for that explanation. What would you say are some early signs that somebody is starting to deal with eye-related health issues? Like, are there other signs outside of just vision-related challenges that might indicate there's something going on?
So there's a saying that says the eyes are the window to the soul. And it sounds cliche, but it's kind of true. So if not to the soul, the eyes are the window to the rest of your health, right? So when I look into the eye every single day, first of all, it's the only place in the body where I can directly visualize with a microscope, just a microscope. I can see nerves and blood vessels, and I can assess the health of a whole individual in a very small way just from looking at the eye. So I'm able to see things that patients sometimes aren't even aware that they have, right? So I can see early changes with blood pressure in the vessels of the eye. I can see early changes with diabetes and blood sugar issues by looking at the eye. So we have these amazing tools. That's why it's kind of almost a superpower to be able to look into the eye and see just these fascinating structures and small, tiny changes. But your question was more talking about what are some signs that we as a patient could notice? What could I as a patient notice that could be an early sign of something going on? And my typical response to this is I'm a little bit of a minimalist, or I like to be a little bit hands-off in most things. If it ain't broke, don't fix it, right? But if a patient notices something about the way their eyes feel, the way their eyes see, or the way their eyes appear, then those would be reasons, I think, for seeing an optometrist or especially an ophthalmologist earlier than later. Or if you do happen to have a family history of some of these issues, let's say you have problems in your family with glaucoma or macular degeneration or early cataracts, these are reasons to see an ophthalmologist definitely regularly, at least once a year. And if you have other chronic health issues, like we mentioned, high blood pressure, diabetes, those would also be reasons to see an ophthalmologist or an optometrist regularly.
Kind of going off of that, what are those top 5 reasons if we were to just identify? I know it sounds like glaucoma, cataracts, things of that sort. Could you just list the top 5 or so reasons that patients come to see you?
Top 5: dry eye, cataracts, glaucoma, diabetes, and problems with glasses and contact lenses. So I see patients every day with all of these problems. Some of them we can fix. Some of them are even a quick fix. And some of them take a little bit more time. But it's really miraculous to see all the technologies that we have in order to help patients with these problems. So one of the things that I'm really excited about is something called Lacrifill, which is a hyaluronic acid based gel that we can now use for helping people with chronic dry eye. And we have it available at our practice. It's one of the things we've been using for several months now. And essentially what it is, it helps people to keep the tears from leaving the eye too soon. When you cry in a movie, or when you cry, I cry in movies, or when you cry because you're listening to a funny comedian, you're laughing so hard, you don't just cry down your cheeks. In fact, you have tears that will start to come out your nose because there's a drainage system that connects the eye to the nose. And so with these newer dry eye treatments, what we can do is we can intentionally put a little natural hyaluronic acid gel in the tear drain. And that keeps that moisture on the eyes so that your eyes don't dry out during the day. So this is a great treatment, and I've had it done myself. I have dry eye. Some of my other patients have had it done, and they've really enjoyed a great relief. So that's just one example of something really simple that most of us will deal with over the course of our life. And there's many other things that we can use for different other issues.
Can you give us some ideas of what some of those other treatments would be? I know there's probably various ones for all of these different top 5 conditions, but maybe just a couple other ideas aren't as simple for individuals that you commonly see in your practice?
Yeah, absolutely. So my favorite thing to do is to get people seeing better. I like that satisfaction that they feel and that I get to feel when I've helped them correct their vision. And so for people who have spent too long in glasses and contact lenses, or people with some cataracts, which causes some blurriness to the vision, some haziness to the vision, especially patients who are a little bit older, but even as early as age 50 or 60 can start to appear. And so with these types of issues, we can do little surgical procedures, and they've really advanced over the past several years. And that's what I'm specifically trained to do, using things like lasers and corrective lenses. We can now replace, basically, we can put your prescription into your eye so that you don't need those glasses or contact lenses as much or at all. I'd like to show you with a little eye model. So this is a model of the eye, and everybody knows what the front of the eye looks like, but not a lot of people are really familiar with the inside. And inside, we do have a natural lens we're all born with, and you can see this one is crystal clear. And for most people, when we're born, it's crystal clear. As we age, it tends to get hazy, and we start to look through something dark, hazy, cloudy. That's a cataract. It's when protein builds up in your natural lens. And as you can imagine, now light will not go through very well. Won't be able to see and won't be able to focus. So what is a cataract removal? What is a cataract surgery? We remove this old cloudy lens, and then we can replace it with a synthetic lens that stays for life. And it's inert and it stays there right in place. And at the same time, we can put in the proper prescription for your eye. We can even use some technologies that will help people get vision that's similar to what they had when they were younger, where they could see far off in the distance and then they could focus at their phone really close near. So these are some things that we can do to help people get better vision and better benefit at the time that they get cataract surgery or they get vision correction surgery.
That's so fascinating. I can't even imagine. Maybe we can chat a little bit more in detail. Like, are we taking off that front layer of the eye, putting that lens in, and then closing it back up? Like, what does that look like if someone is considering these surgeries, but maybe is a little bit wary? What does that surgery tend to look like?
Sure. So first of all, eye surgery in general has progressed a long way over the past 20, even the past 10, or even the past 5 years. And so it's important to realize that, yes, it does sound scary, right? I want to validate that. It is scary to think about your eye being touched or having a surgery. It does sound a little bit scary, but those of us who do it a lot, we're very familiar with all of the issues that can arise. And by using the latest technology and the latest techniques, we can make the risk that seems astronomical to a patient actually be very, very, very low. And so when you talk about the different ways to correct vision, there are a couple ways that come up. The first one everybody's heard of is called LASIK. And there's different varieties, but essentially they're all doing the same thing as a general goal. There's a front surface to the eye called the cornea that's clear. And that is the area where the most of your prescription is located. And so with LASIK, we can use a laser. We make a flap. We flap that flap over, do another little laser, put the flap back in place. And then that means we've removed your prescription from that part of the eye. So you'll be able to now see clearly with less glasses and contact lens prescription. That's it. That's in a nutshell. Okay. Now, there's different varieties that exist. We don't probably need to go into all the different varieties, but the important thing to know is that with everything that we do in medicine, there's benefits and there's some small risks. And what I usually tell patients is similar to driving, where 99.9% of the time we get there safely and everything goes great. The same with surgery. 99.9% of the time in most of these, even elective surgeries like LASIK, we do very well and patients do very, very well. But there's always small risk. And that's just something I still remind patients every time I see them. The other thing I try to tell people is that if you're really scared of having something done to your eyes, don't do it. Don't do anything you're not comfortable with. And especially go find an ophthalmologist that you feel you can trust, that you feel like you're in good hands, and feel like they understand your issues and they'll be there for you if you have any problems at all, even if it's just for some reassurance. You want to find somebody that you really feel like you trust. And that's, I believe, is one of the most important things. Ignore some of the noise and find the person that you really feel like you are in the best hands. And that's the person you should choose if you're going to have some elective procedure done. Think about plastic surgery, right? An analogy, right? We think about people who go get elective plastic surgery and, maybe go overseas and get something done and have a horrible, outcome. And there's reality shows based on this that I may or may not have ever seen. But that's the idea, right? Is that we want to, if it's your eyes, don't compromise, right? Go and find not just the best with marketing, but find the best that is going to be in line with your values, is going to be in line with your personality, and has that high level of trust that you need.
Completely agree. And I think that's really helpful to dispel some fears and things. And even just talking about the how and the why, I think is helpful for individuals to gain a bit of a better understanding.
Tired of long waits and rushed appointments? Switch to PPMA's concierge medicine. With 24/7 access to your doctor, personalized care plans, and extended visits, your health is our priority. Discover the difference at privatemds.com.
Just to circle back to one of the earlier things that you were mentioning, right? How the eyes are the window to the soul, how in this small organ you can see and learn so much about someone's underlying health conditions, maybe advancement in their diabetes or development in their hypertension or something along those lines, right? That elevated blood pressure. So kind of circling back around, right? Lauren and I are dietitians. So thinking a little bit more about the nutrition lifestyle piece of things, how do you maybe see lifestyle interventions influence some of your patient outcomes, whether that's concurrent to surgery, or if someone decides to maybe not do surgical interventions right off the bat, but maybe try some other things prior to that? Do you have an example of a patient who might have seen some improvements to their eye health specifically by changing exercise, lifestyle, nutrition, things of that sort?
It's funny. I read an article a while ago about a group of patients who were older, and they were basically, in retirement age, and we all know they probably had some vision problems. And what they did is they put them for a few weeks with their peers in kind of a flashback moment where they put everything themed, and everything in their environment was based on when they were younger. So it felt like, let's say they were, in their heyday in the 40s. And so everything felt like, 40s and 50s, right? When they were 20 or 25 or 30. And something remarkable happened. Their memories improved. They found themselves thinking more clearly. They were seeing better. Right? For some reason, they felt like their vision was better. Now, I don't really know why all of that happened, but my belief, kind of a non-medical opinion, is that there's a lot to do with our attitude and our mindset and effort and things that we do for ourselves. So I think your question is really great, because there are things that we can do that don't involve surgery, that don't involve, doing anything that sounds like a lot, right? It could be something very small. And so those small shifts that people make in people's lifestyle absolutely affect their eye health. And I would say that there are some things that we can do. We've mentioned dry eye, for example. And I tell patients that there are many things that can be done at home for dry eye. Sometimes certain supplements, such as omega-3s and fish oil supplements, can help those healthy oil secretions in the tears be more healthy. And some studies have shown that. Do carrots make your eyes healthier? Healthy diet does, but I don't think a boatload of carrots will heal your eyes if you've got some severe eye issues. Overall, though, the studies show that some antioxidants are the most helpful for certain kinds of eye conditions. For example, macular degeneration. And so this is a condition that happens in older people, usually. It's usually called age-related macular degeneration. And when a patient uses these eye vitamins, they've shown in the studies that these antioxidant vitamins called AREDS2, they decrease the rate that they get worse. Doesn't usually make it any better per se, but it decreases it and makes it slow that rate of progression. So if you were to ask me, what's the single thing I could do to take care of my eyes, I would say healthy diet, exercise, antioxidants in your diet or with supplements, and omega-3s and fish oils. Those are some simple lifestyle things that we can all do, and it will improve our general physical health and our eye health as well. And finally, not to be forgotten, is to avoid smoking and tobacco use. If we can do all of those things, we do a great deal to improve our systemic health and our eye health as well.
Well, I certainly would echo all of that. So can't forget the nutrition piece of things. And yeah, like you mentioned, right, we know just how impactful omega-3s can be, for example, for so many different health conditions. And again, if your eye and vision issues are related to hypertension, diabetes, conditions of that sort, right, there's so much that we can do through nutrition and lifestyle interventions for sure.
Absolutely. Absolutely. And, the pair to this again is if the rest of your body is healthy and you're seeing well, I want them to not worry, about the things that could happen. I want them to, my adage is an ounce of prevention is worth a pound of cure. And so I want people to live those healthy lifestyles. I want them to feel confident that they should, that they're healthy, and then still come in for the regular eye checkups. But sometimes, patients will go even overboard and they'll feel like they should be doing more. And oftentimes those patients in that scenario, and probably patients who are listening to a health podcast, may need to know that actually, if they're that health conscious, that they're doing something right already. And they could probably use a little bit less stress around some of these things. And if the eyes are seeing well, then we worry a little less as ophthalmologists.
Absolutely. Perfection's never the goal. Anyway, where we can just make moves in the right direction is a great place to be. Well, Dr. Shumway, it was such a pleasure to have this chat with you. Thanks so much for your time. For anyone listening who may not be familiar with your practice, but would like to schedule a consultation with you or just learn more about the practice, can you tell them a little bit more about where they might be able to find you?
So if you'd like to book a consultation or check out our office, we're here in Newport Beach near Hoag Hospital. We're at 520 Superior on the second floor, number 295 in Newport Beach. And then our phone number is 888-969-9696. Our website is beacheye.com.
Wonderful. Well, super close to PPMA. And for any of our current PPMA patients who would like to get set up for a referral, please just give our office a call and we'll have that information in the show notes. We'll have Dr. Shumway's information in the show notes if you'd like to give them a call.
Yeah. Excellent. Thank you so much. I appreciate it. Have a great day.
Thank you. Thanks, everyone. Catch us in a couple of weeks for another episode.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.